Well, this is Pamela Harrison with NASCSP. I'm looking at the screen. It didn't appear to advance to the next slide. So on the next slide, when it advances, you will just see a picture of Mary Beth and I. I am the CSBG State Assistance Director, and we just wanted to provide this slide with our picture so that you will have the opportunity to identify who it is that is talking. We didn't want to just be talking heads as we're moving forward.
Okay, it sounds like I'm hearing that folks can see the slides advancing. So I think we just have a little bit of a delay, so if you'll just bear with us, appreciated. So Pamela, I'll go ahead and introduce myself. This is Mary Beth Schnaber-Remrev. I'm the CSBG State Assistance Deputy Director with NASCSP. Really happy to be here with you today. I'm excited to talk about community level work with you. Just for a little background about me, I spent 7 years at a local agency, and then I spent a little over a year at the state office before ultimately joining NASCSP. I'm really happy to be a part of a team, and one of my favorite things about working at the national level is getting to hear from all of you and learn how CSBG is implemented differently across the country. So even though you know, you're here to learn, we're also here to learn from you. So really excited to be with you today.
And actually, Mary Beth, this is Pamela again. Thank you for that prompt. I actually neglected to provide my background information. I previously was with the state of California and was the CSBG administrator for the Community Services Block Grant for the state. I spent 20-something plus years with the state of California before joining the NASCSP team. Next slide. Just wanted to take the opportunity to provide some background information about NASCSP for those of you who are not familiar with our organization. So NASCSP is a member association. NASCSP members are state administrators of the U.S. Department of Health and Human Services Community Services Block Grant, CSBG, and the U.S. Department of Energy's Weatherization Assistance Program, the DOE Weatherization Assistance. NASCSP provides research, analysis, training, and technical assistance to state CSBG and weatherization offices, community action agencies, and state associations in order to increase their capacity to prevent and reduce poverty and build economic and energy security. We can move to, okay. As you can see, the objectives for this, I think the screen just went blank. Okay, good, it's back up again. The objectives for this session. Now, the Community Initiative Form is the entry form for community action agencies reporting community level in Module 3 of the CSBG Annual Report. The CIS is new to the reporting process in 2019 and can, if used effectively, assist the network in telling the story of our community level work. This session will cover the elements of community level initiatives, as well as how the Community Initiative Status Form is not only just a reporting requirement, but can be utilized as a planning and diagnostic tool during the creation of a community initiative. In addition, we will review the checklist to evaluate the community initiative examples. Next slide.
Okay. Great, thanks, Pamela. I'm going to talk through the performance management framework just to help frame our conversation. What you should be seeing on the screen now, I hope, is our national theory of change. And I hope you all have seen the national theory of change before. And just to give you a little bit of context about the national theory of change, it describes the elements of a common framework that we as community action agencies have to produce change. It portrays the broad picture of community action, our long-term goals, our core principles, our system capacity. It also identifies the assumptions that help guide the design of services and strategies that we use to reach those long-term goals. And lastly, you notice it demonstrates our commitment to accountability via performance management. And one of the big links I wanted to point out to you in our theory of change is that in our core principles, we advocate for systemic change. We pursue positive individual, family, and community level change. And we recognize that we cannot pursue only family and individual level work to address the complex causes and conditions of poverty. One of our national goals really focuses on improving the community. That's goal 2. And I just want to drive home the point that we as community action create change for people and communities. The Roma Next Generation framework has some key additions within it, and these are those key additions. I just wanted to be sure that I point out the added CSBG Annual Report and that increased focus on community level work as key additions to Roma Next Gen. And then just lastly, or not lastly, the CSBG Annual Report, the framework of it essentially has 4 modules. Module 1 talks about state administration, although local agencies also provide input into Module 1 as well. That's where we talk success stories, we talk organizational standards, the activities that we've done in the year to improve customer service. All of that goes within Module 1. Module 2 of the CSBG Annual Report is where we report eligible entity expenditures, as well as capacity. So that's where we're reporting certifications, volunteer hours, and then also other available resources to the CAA beyond just CSBG funding. Module 3 is where we report our community level work, and that's going to be the focus of our discussion today. And then Module 4 is where we report those individual and family level initiatives that we run. And I just want to point out here that the CSBG Annual Report is part of a larger process. It doesn't happen in isolation. This all starts with your community needs assessment. And that's something you're going to hear Pamela and I refer back to fairly often, is the importance of that needs assessment. Your needs assessment informs your strategic plan. And ultimately, those things combined inform your community action plan. All of this informs the state plan. And then the annual report is where we talk about what's actually happened, right? So we did all of this planning for what initiatives we were going to run based on the needs of the individuals. The annual report is where we're able to talk about the so what, and so what happened. And I just want to point out that it doesn't end with the CSBG annual report. That data actually does come up to the national level. We utilize that to do some analysis at the national level, to create state profiles of services and outcomes achieved by each state. But we also use this to inform the congressional report. So Congress does have, essentially your annual report data informs the information that Congress receives about CSBG. So just wanted to point out that larger connection. And with that, Pamela, I think I'm going to turn it back over to you.
Great. Thank you, Mary Beth. Now, as we get ready to start reviewing Module 3, just want to, recognize and identify that there has been some anxiety out there in the network regarding the community level module. But we will walk through the module and identify what you can report on. Understanding and recognizing that not everyone is able to report on the same kinds of community level work, but we will be identifying some of the community level initiatives. And I hope you recognize the CSBG Act, and as you see displayed, Economic Opportunity Act. And this is just as a visual, it has always been with us. Community level work is not a new concept. So as you see in the Economic Opportunity Act, it's addressing poverty on both the individual, family, and community levels. Next slide. Okay. Community level work has a clearly defined purpose or goal to create measurable community level change in a specific community. So you want to think about the difference between providing a service directly to individuals or families and working on a multi-part strategy with others in the community. And I'm actually just going to pause a minute for individuals to be able to read the slide before advancing.
Sorry about that. Let me get back there.
Just a minute. There's a lot of information. Just wanted them to have the opportunity to read and digest before moving briefly.
And this slide, this really frames out that definition of community level work. And Pamela, I appreciate the opportunity to pause here. Essentially, a community level initiative. One of I see a question just came through too. Essentially, that this is work that we do that has that clearly defined purpose or goal that creates that specific community level change in a specific community. And that specific community is one of the things that I think there's always conversation about. That can be as small as a neighborhood or a census tract or as big as a service area. And I do see a question here that says, does community level mean the CAA cannot do the project solo? And we're going to get there in a little bit, Tony, about that, about how how CAAs can do some work solo, but ultimately a lot of times we see this done in concert with other community partners. Pamela, I'll go ahead and advance that slide if you are.
Okay, great. Yes, thank you.
Perfect.
And so ultimately, when you are doing community level work, it starts with the community level need, which is identified in your community needs assessment. So you want to consider, for example, the difference between adults with low income versus limited living wage jobs. So that's the difference between if you're identifying a family level need versus a community level need. Next slide.
Great, thanks. So I think that this slide kind of paints that out a little bit further, that when we do our needs assessment, we know that there are conditions. We often identify a category of need, right? We say that there's an employment need within our community. And you delve in and you identify whose need is it, right? If we have Roma trainers around here, you'll know that whose need is it activity. And we know that a need can exist at a family or a community level, and in some cases an agency level as well. So this slide really walks through how different conditions, the outcomes that you would seek to obtain based on those different community levels, those different community conditions. So if you look at the first line, we have our community lacks living wage jobs, which indicates that there is within the community itself a lack of opportunity, a lack of jobs. This is different from people do not have living wage jobs, right? Those are two very different needs, and your approach and outcome would be very different to each. With community level, with this first example, our community lacks living wage jobs. Your ultimate outcome there would be an increase in living wage jobs, and that's positions available within the community. what would be an individual or family level outcome would be the number of people who attain living wage positions. So see, there's a difference there between measuring that change at the community level, the increase in the asset and the resource that exists at the community level, versus the individual family level change that would occur. So if you look at the next example, there's a need for more affordable housing, okay? In that need, your outcome would ultimately be, at a community level, would be creating more affordable housing units made available within the community. The individual and family level outcome of that same need would be the increased number of people who obtain permanent and affordable housing. So with that, I'm actually going to advance to this next slide to try and paint the difference for you between what would be considered family level work and family level need versus community level need. So on one side of this, you see a community that has lots and lots of housing options. And the graphic essentially is indicating that these individuals here, there would be a difference between this side of the graphic where individuals have plentiful housing options that they cannot afford versus the other side of this graphic where we have a community that has lots of people, but the housing stock that's available does not meet the needs of the people. You know, in the second graphic there, I could provide housing vouchers all day, but if there was no safe and affordable housing, it would really never address the root cause of that problem. You have to understand where the need lies. You have to identify whose need is it. And that is really vital and key to understanding the planning and implementation of a community level initiative. And Pamela, I'm going to kick it back to you.
Okay, thank you. So actually, we're going to start walking through some examples of community level initiatives. So this slide it displays the definition of community level work. So after conducting the community needs assessment, and as you're strategically analyzing on whether the need is community level, these are some questions to consider. And individual agencies are not expected to change the complex causes of poverty or alone or overnight. But it's also critical that the agencies analyze community needs and pursue partnerships that are right for the particular agency and community. Next slide. Now, this is an example of a community level initiative where the coalition is going to reduce opioid deaths by 50% by the year 2021 in Boise, Idaho. The need was identified through data. As you see, the agency is part of a partnership, and this initiative identifies the areas of focus in addressing the community level need. Next slide. Again, another example of a community level initiative to reduce poverty by 30%. The agency identified the local agencies involved, supported the fact that data was used to identify the issue, and then the members of the community that are part of the partnership that will be addressing the need. I do want to point out also in this slide and the previous one that had the percentages, and which we will be discussing further, that when you have a percentage that you're going to reduce poverty, it's very important to have a baseline to start with, because you need to have the baseline to be able to calculate your percentage achievement accomplishments. Next slide, and I'm actually going to kick this one back to Mary Beth.
Great, thanks, Pamela. So I know we're not supposed to have favorite examples, but this one is my favorite because it was my own here in Louisville, Kentucky. when I was at a local agency, we joined a coalition that aimed to increase kindergarten readiness rates in one zip code in Louisville. And an interesting story about this, my agency had offered preschool scholarships to try and address the need that we had identified of children who were not ready for kindergarten. And that was particularly true of kids with low incomes. So my agency elected to offer these scholarships. But then we were approached by this coalition who was working in the 40210 zip code here in Louisville. And they approached us because they could see that we had this project. We cared about kindergarten readiness in our community. And they said, you know, did you realize that in 40210 that there's not a single preschool available within that zip code? And the light bulb went off that here we were trying to move the needle on this issue of kids not being ready for kindergarten, but that really, you know, what we had was in some cases a community level problem. There was a lack of resources that existed within that community. So it didn't matter that, you know, we were providing the financial resources to be able to go to preschool. This community had no resources for people to access. So in this case, ultimately what we did is we joined alongside this coalition, and we utilized multiple strategies to target this specific zip code in Louisville. And just for your reference, the reason that it was this specific zip code was because it's one of the lowest income zip codes in Louisville. And it also had one of the lowest kindergarten readiness rates within Louisville when we aggregated that data. There were a number of partners involved. Metro United Way was involved. The public library was involved, the school system was involved, and then we utilized multiple strategies to move the needle on increasing kindergarten readiness rates as a whole for this entire community. So we had a little library campaign because we know that when kids have books in their homes, they're more likely to be kindergarten ready. We also took a look at the community and we said, okay, we know that kids are going somewhere during the day, right? So where are they going? And what we discovered was, you know, kids are going to child care centers in this community, and they were plentiful in this community. And so rather than, it was unrealistic for us to build a preschool in this community. So ultimately what we elected to do was to work with that existing infrastructure. And we worked with the child care facilities within the city of Louisville or within that zip code and gave them training. We gave them preschool curriculum. We gave them support and classroom materials. And as a result of this, we were using our baseline data and then the data, our follow-up data a year later, we were able to measure that the kindergarten readiness rate for this zip code actually went up. And what was interesting was when we correlated it out to the larger community, this zip code's kindergarten readiness rate went up when other communities actually had a decrease. Overall, as a whole, Louisville had a decrease in kindergarten readiness rates. But this zip code where we ran this initiative, one of the lowest income zip codes had an increase. So that's just another example of a community level initiative. So again, we're talking about creating those changes that are about the conditions of the community. We're not talking about doing the work for the individual people. We're talking about creating that community level change. So this next slide is where we need to differentiate between working in the community versus creating community level change. And I just want to pause here and just say that any of these initiatives that we have listed, just because we say that they are not in and of themselves community level work, does not mean that these are activities that the agency shouldn't engage in or that it's not good and important and valuable work. The point here is that these, what we have listed here, we feel are generally strategies that exist in a larger campaign to move the needle on community level change. So I'm going to talk through each of these just really briefly and try to pull out here why these items would not be community level work, even though it's work done within the community. So a job fair. A job fair would indicate that there are available jobs in the community and that you're connecting people with low incomes or your general population to those available jobs. So a job fair would be about creating individual and family level change. Now, if you had a larger campaign where you brought a new employer in to the community and you have new jobs available, a job fair might be a strategy that you utilize in that larger campaign. But in and of itself, a job fair does not change anything structurally about the community. A poverty simulation. Poverty simulations are often about changing individual attitudes towards poverty and raising awareness, but that's at an individual level. This does not correlate to a broad community level change. Operating a VITA site. The key word here is that operating. If you have always run a VITA site, simply operating it is not offering anything new or changing anything about the community. Now, if you had a community that perhaps had no free tax assistance, you identified that in your community needs assessment, it was a need that was identified, and you then secure and bring a VITA site to that community, that could be a community level change, right? Because there's a physical change that has happened in terms of the resources that are now available in that community. But I do just want to say that would only be reported essentially one time. Once you got that program up and running, the work that you did in your VITA site would be reported in Module 4, where you would count out the number of people who receive assistance or have changes in their financial empowerment. Running a Head Start program is the same concept. Simply running a Head Start program is about creating change for individuals and families versus creating a change at the community level. A food pantry is similar. We're talking about distributing pounds of food or meals to individuals. We're creating family level change in those instances. And again, that would get reported in Module 4. And ultimately, your hint that something may not be appropriate to report in Module 3 and should just instead go in Module 4 is as soon as we start talking about helping people to obtain housing, employment, or other individual level outcomes. So here is similar to the slide where we talked through those needs and outcomes. Here is a depiction of, based on the community condition, work that would likely qualify as community level and what might not qualify as community level. So if you take that high unemployment rate, your community level work would be about increasing living wage jobs in the community. What would not be community level work would just be to add an employment training program. An employment training program won't change a high unemployment rate in and of itself. The homelessness rate, perhaps you're doing some work to implement policy changes, add new housing, and enhance and offer enhanced services, all targeted towards decreasing that homelessness rate. That could be community level work. Whereas when we're talking about operating services for homeless individuals, that's about creating change for individuals and families. again, I go back to it's important work. It just gets reported in Module 4 instead of Module 3. The poverty level is here's another example where, you know, if you were bringing together a task force that is creating that community-wide strategic plan and rethinks and reorganizes the delivery of services all towards a targeted goal of decreasing that poverty rate, that would be community level work. Not community level work would just be simply implementing a referral system. And again, even though implementing that referral system can be important, valuable work, it likely in and of itself will not create community level change that will move the needle on that poverty level. There's a question that says, for a small CAP agency, can you give an example of how to increase jobs in a community? Some small community action agencies may have a micro business program where perhaps there's some assistance to help get new businesses started that actually increase the availability of jobs within the community. That's just one example off the top of my head. Pamela, do you have any others?
No, Mary, but I think that actually was a good example. Oh.
And then, right, there's another question about an internship program through the city. And I guess my question would be, what is the goal of that internship program? Is it about providing individuals the opportunity to gain experience in order to then go on and obtain other employment? Or is this about trying to, as part of a larger initiative, perhaps, that you offer internships? I think, Tony, your next example, take a leadership role in creating a task force to address the need for jobs, right? That you could also join those. I think that's a really good point. This goes back to a question I think that I saw earlier. The community action agency doesn't have to be essentially the lead agency in order to qualify for community level work. Small agencies and big agencies too can join coalitions that work together to move the needle on a community-wide initiative or a community-wide rate. Okay, I think I'm going to advance this slide and send it over to you, Pamela.
Okay. So we will now begin reviewing the community initiative status form. Next slide. So this is the form that is utilized to report Module 3, the community level initiatives. And I want to emphasize this is for the community level initiatives that this form is being used. And it would not be a reporting burden throughout the year. So you need to consider that the information for this part of the report would be from the planning phase of the agency's cycle of work. The identification of the need would have been done in your community needs assessment process and clearly stated as part of the planning process. So you have your initiative name, your initiative year, you know, how many years is it going to take you to complete this initiative? Problem identification, what is the problem? Is it clearly a community level initiative? Do you have the data to support how this need or the problem was identified? Your goal agenda, provide a narrative on the overall goal of the initiative. This should be the ultimate outcome the initiative seeks to achieve. Now, this is different than the indicators that the initiative will be used to report. This section is a description of the overall goal. You have the community domains, you know, what is your expected outcome? Identified community. As Mary Beth indicated earlier, what is the specific target area? Is it neighborhood, city, school district? You want the reader to have an understanding of the community in which you are addressing the community level need. providing there on the duration, and then also the partnership type. Whether you're independent, I think the question came in is that can you conduct this community level initiative solo? You can, but it's always easier, I think, to be part of a collaborative process, because I think in working with community action, we understand that there are projects that we cannot accomplish alone solo, and it's better to have a partnership to be able to collaborate and strategically be able to identify what the need is and how together as a partnership you're going to address the needs within your community. And I want to stress, this is not about filling out a form. It's about providing a standardized framework for a national dialogue on our network's community work. And so in this section, this is a form, this would be completed at the end of the year. So you provided information narrative on your partners' strategies, and we will actually, there's a slide that identifies the strategies that you can select from. Progress on the outcome indicators. There's actually, when you're completing the form, there's a drop-down menu. So there's options to include no outcomes to report, interim outcomes, or final outcomes. If there are no outcomes to report, then the form would be completed when the initiative is in progress. Interim outcomes should be selected if an initiative is ongoing, but there are outcomes to report. If there are interim outcomes, or this is the final report on the initiative, additional information will be requested as outlined in lines 13 to 16 of the form. Impact of outcomes. You want to discuss the scope of the impact of outcomes. This is where the CSBG eligible entities provide background, detail, and our context to the numbers they're reporting. Lessons learned. Provide a narrative on any lessons learned during the implementation of the initiative. The narrative may be entered at any stage of the initiative. You want to include information on what went well, barriers to success, any significant findings or issues that occurred during the initiative, and what would you want other local agencies to know before they are taking on a similar initiative.
So
I will.
Go ahead.
No, I was getting ready to say, I will turn it back to Mary Beth, but you have it, so go ahead.
Great. So I think that as we were going through that, one of the things that I hope that you noticed is that this really sounds a whole lot like a logic model, doesn't it? We're talking about identifying your need. We're talking about identifying the community. Whose need is it? We're talking about what kind of partners you have and those strategies. And so essentially what we have on the screen for you and also available on our website is a crosswalk between the logic model and the community initiative status form. Everything on a logic model you are going to find in that CIS form. The CIS form, the community initiative status form, is the logic model for community level initiatives. And so as we're going through each component of this form, well, we're going to highlight some of the components of the form, and the way that we're going to frame it is actually in the frame of the logic model. So it's not necessarily going to follow sequentially 1, 2, 3, 4, but grouping those items that naturally go together. So we're going to start by talking about your problem identification and your identified community. So in your problem identification, this would really be done during your community needs assessment. And it would be clearly stated as part of your planning process. And so as part of that community needs assessment, when you're identifying the problem or the need that exists, you're also identifying whose need it is. Where does the need exist? Is it at a family level, in which case that would be reported in Module 4? And then if it is at a community level, what community are we talking about? Are we talking about a neighborhood, a school district? It might be your whole service area. And so with that, Pamela, I'm going to kick over to you to talk about how to complete your problem identification.
And just piggybacking on what Mary Beth said, these are what is the need? The narrative cannot be one sentence, but you need to have a clear understanding of the problem and how it was identified. And I said piggyback, and this is conducted or identified during your community needs assessment. What was identified? How was it identified? This kind of ties into the data that you're providing to support the need. What are the consequences of the situation? How was the community impacted? Who's affected by this situation? What factors contributed to the problem? So just being able to have a clear understanding of what the need is. Are there resources available to address the problem? If there are not resources, then what will your collaborative partnership, provide? And what are the gaps in services? What are the gaps in meeting this community level need? So it's essentially just being able to paint the complete picture so that there's full understanding of what the need is. Next slide. Now, there is a lot of information on this slide, but just wanted to point out that in this problem identification, you're able to, you understand what the need is, baseline data, less than 1% vacancy, long waiting list for subsidized units, credit checks and other barriers for marketing housing. It identifies the gaps in the community, and it has all the elements of the problem. And actually, it says housing has appeared in the top 5 community needs in every county served for over a decade, as cited by customers, stakeholders, and national data research. So you have your backup supporting documentation. Just going to pause, Mary Beth, to allow the viewers to be able to read through this slide. And as you're reading through and considering, think about the questions that were on the previous slide. What has been observed, identified, you to believe there's a community level need? You can see that in this problem. How was it identified? What are the consequences? Who's affected? What factors and what resources are available? Now, in contrast to the previous slide that contained all of the information required to identify the problem, this is lack of reliable transportation for individuals and families to access affordable health care. As you can see, there is just not enough information and detail to understand the problem, and if it is a community initiative. So it's really critical and important to be able to provide that detail so that to be able to evaluate whether it is a family level need or a community level initiative. Next slide. And this should match your problem identification service area. Who is impacted and where does the need exist? So that is section 7 of the form. Next slide, and I'll turn this portion back to Mary Beth.
Great, thanks, Pamela. So now we've talked about what's the need and whose need is it, right? And so following that logic model, you're going to want to talk about then what's your outcome, right? What's going to change what's your ultimate goal in running this community initiative? So with the goal and agenda, you're really looking to provide a narrative on the overall goal of this initiative, and this should be the ultimate expected outcome. This is different than the indicators that the initiative will use to report. This is narrative in nature. That section is really a description of the overall goal. Your information from a community needs assessment would be good to consider and discuss here. And then those indicators would be identified in number 6 that correlate back to your ultimate goal. And I guess one of our pro tips here would be that, you know, as you're filling this out, ask yourself, would a reader that is unfamiliar with this initiative clearly see how the goal in line 4 aligns with the problem in line 3? Okay, so we'll talk through this a little bit more. So with your goal and agenda, just like we talked about before, this should not be one sentence. These in some cases are huge community projects. We need to understand what your ultimate goal is and how you're going to get there, right? Tell us what you're going to do, how you're going to get there, and how long it's going to take you. We recognize that these big community level initiatives, often the change doesn't happen overnight. It may happen over the course of multiple years. So this is your opportunity to tell us about that. So clearly articulate, what is your ultimate goal? My ultimate goal is to reduce the homelessness rate by 2%, or my goal is to build, 40 housing units over the next 5 years. This is then where you can put in some interim goals. So perhaps if you're going to build those 40 houses over 5 years, perhaps by year 3, you intend to have 20 of the houses built. So you can outline that within your goal and agenda. You also want to be sure that you describe how this initiative really addresses that problem at the community level, and the community change, and how the community change will result. And I think that the example on the slide is really good. If the need was for more affordable housing in the community, the goal then is to increase the number of affordable units versus assisting more families in searching for housing. If there's no housing for them to move into, then that strategy wouldn't align with the need that was identified, okay? You want to be sure that you describe your role within the larger initiative. Tony, I think that this goes back to your earlier point. You can be on a coalition. We just want to be clear about what the CAA's specific role is. And it's fine to say we're a lead on this coalition, or we're a partner in this coalition. You can also describe the role each key partner plays within the initiative. That also is in line 10 of the form. So just to give you the contrast again, this is an example where we think that this would be considered pretty complete. We clearly understand that their goal is to develop the 70 units in the 3-county service area. They have multiple phases, which they explain out, what those phases are, where they're going to build, what they're going to build. And I believe they also have some partners named in here, and how long it's going to take them for each phase. So this is a really good, robust goal and agenda. You can read this and understand exactly what this agency is doing. If you compare that to this one, and not that this is, it doesn't have all of the components and information that we need to be able to understand what this agency is doing, okay? So this could really be beefed up to explain perhaps that there is no transportation system available to support people with medical appointments, and therefore we're going to add a transportation system and spell out all of those metrics. So on the next piece of this, so number 4 is where you're giving us your goal and agenda, is where you're giving us the narrative of what you're planning to do, your ultimate expected outcome. But line 6 is where you're telling us what CNPIs, or Community National Performance Indicators, are you using to measure your success. So a couple of points about the Community National Performance Indicators. Just like in Module 4, they're a menu of options. You only report on the ones that make sense for your initiative. Every domain includes an other option in case you don't see your own metric. A word of caution there is really take a good look and make sure it's actually not there. A lot of times people write in an other, but actually the other that they wrote in is an available CNPI. So you'll notice with the new CNPIs, there are 2 types. There are essentially 2 indicator types. There's one where we count the change that occurs, and there's one where we measure the rate of change. And some of the rates of change are outcomes that will take multiple years, and even the counts of change, and we completely understand that. One other point I want to make here is that this is not about adding up all of the clients and calling that community level change. This is about planned efforts with strategies and outcomes throughout. So let me show you, here's just a screen grab from Module 3, where you can see this is the housing domain. And so on the top, you see we have the counts of change, where you could essentially count the number of housing units that you developed, right? Or the number of shelter beds that you created, or the shelter beds that you created. Kind of in the middle there, you see the rates of change, where, you know, perhaps you're not looking at adding shelter beds, but you're looking at decreasing the rate of homelessness. So you have the opportunity to choose which of these make the most sense for your initiative. Oh, Pamela, did I just talk over your slide?
That is fine, Mary Beth. We're a team. You can keep going, and I'll fill in where needed. No problem.
I'm going to steal coffee. You can steal one of mine. Oh, no, and then
but
I'm
actually,
up. Okay.
Well, one point, though, I think I do want to make is when they're identifying whether to report on a rate of change or a count, you know, you want to consider what is the factor that will clearly show that there was a change or a move in the needle. And for example, you know, if you have a housing shortage of 40,000, you're going to add 5 units, it would probably not impact the rate of change percentage-wise. So you probably would want to use that as a count to be able to identify the number of units that were added. You can go to the next slide. And turn it back to Mary Beth.
Thank you. So ultimately, the question here, too, to consider is how will you know? Be sure that you have measurement tools in place. This is specifically important for those rates of change. So you have to have some baseline data, right? You have to have a baseline percent to be able to know if you're moving the needle. So in my initiative where we changed kindergarten readiness rates, I had a baseline year where I knew that the kindergarten readiness rate in my identified community was something like, was it 30? It was 30-something%, I believe. And then the next year, I could compare and see that it increased by 2 percentage points. And just consider what indicators you're using to measure the change, and do they make the most sense for your initiative? Pamela, I'm sending it back to you.
Yeah, just waiting for the slide. There's a slight delay. Okay. So partnership type, I think we have pretty much discussed this in depth, but you want to be able, you identify the type of partnership, And the CAA does not need to be the lead agency to report, but you should be able just to clarify the type of partnership. Next slide. So we have the strategies. What are the strategies? What will you do as you're continuing working in this community initiative status form? And then actually when you report, there is the listing of the strategies. So you identify, they have the housing strategies, the health and social services. There's strategies available for you to select from depending on the type of community level initiative that you are working in. So wanted to provide the listing of the strategies, and you will select from those to have an idea so the reader will understand the strategies that will be used as you're working in the community level, at the community level, sorry. Next slide. So it is important to think about the other players in the community who have or could have a stake in the work you'll be doing. For example, if you're working on issues related to school achievement of a high school population, you would obviously need to engage some aspect of the local school district in the project, but also consider others who might be engaged, parents, church groups, business community, and others. So what you want to do is map your potential partners. Some organizations seek like-minded partners to reach common goals, and the partnerships are formed. Meetings are held, but to what end? Too often these meetings are held without a clear, common, and measurable result in mind. So what causes these well-intentioned efforts to flounder? Perhaps what the members thought was a common purpose was actually most of a general idea, one open to multiple interpretations. So when this happens, collaborative efforts are likely to fail. So what you want to make sure is that you have a common vision as you're considering your partners and you're coming together. So without a common vision, measurable results are unlikely to occur. Next slide. So this is an example of a description that's outlining the partnerships that will be working together within the community level initiative.
Okay, and as we're, I realize we're coming up on time pretty quickly here. We're going to round out the rest of the form here, talk about impact of outcomes. So this is where this is where an eligible entity can provide that background detail and context to those numbers that you're reporting. So all this time we've been telling you, Module 3, you don't report people here, and that is absolutely true. Line 13 is where you are able to talk about the impact of the community level change that you've done. So for instance, if you had created a health clinic, you created one health clinic, and there will be, what you could put in here though, is that there were 500 families who were served. You don't actually report the families here, they get reported in Module 4, but you're able to talk about that because I was able to bring this health clinic, I was able to serve these 500 families with these kinds of services, fill in the blank of the services. Mia, yes, the PowerPoint will be available. I think Lawrence will be sending that out for us. And then the last point on the form that I want to talk about is the lessons learned. section, this is your opportunity to talk about what worked and what didn't work. Sometimes when people hear lessons learned, I think they hear only negative, but this could be positive too. You might have discovered that there was a grant opportunity for the kind of project that you're running. Or on the flip side, maybe you plan to start construction in November, which perhaps in Region 9 isn't such a problem. But in my neck of the woods, starting a construction project in November would be risky. This is the opportunity to document those lessons learned, both for your benefit, but also think about others who may want to run similar projects. Think about, the lessons learned of your, that you could add to your peer learning through this. And so here's just an example of a nice, robust lesson learned from an agency. Again, this is, one sentence usually doesn't cut it. I'm saying usually, but this is a nice, robust example. So just to quickly run through, I want to make you all aware of our review tool for the Community Initiative Status Form, if you were not familiar with it already. This is available on our website. And this tool essentially is very similar to the checklist for the logic model. It's a way for you to check your work and ensure that you have a complete Community Initiative Status Form submission. So as you can see, what you have, I don't know if you all can see my cursor, it's the base of the form, but then we have these nifty checkboxes where you can go down and ask yourself these questions. And a lot of this is what Pamela and I talked about in this presentation today, so that you can check your own work. I'm not going to belabor this point. It's a very useful tool. We've gotten tons of positive feedback about it. There's value in using it at the local and state levels. So I think we're going to do a quick run through of some of the frequently asked questions that we get, and I'll turn it back to you, Pamela.
Okay, if you can go to the next slide. So here is, frequently asked questions. My initiative also helps people. Where do I report them in Module 3, and how is this different than Module 4? So before I go to the answer, if we were in person, I probably would ask for someone to raise their hand and provide what they think the answer is. So I'm just going to suggest that you take a minute to think and formulate your answer, and then as we move to this next slide, you can identify if it was accurate. Next slide. You would report the people in Module 4. In Module 3 is for the community level initiatives. Is there anything you wanted to add to that one, Mary Beth?
Nope, I don't think so. Maybe just that point that it's not about adding up the people served, right? It's the people go in Module 4. That's it.
Okay, thanks. Next slide. Can I report outcomes from the same program in both Module 3 and Module 4? Answer slide. Yes.
It's coming, it's delayed.
It's there. Yeah, I'm actually pausing till it shows on the screen. The initiative and community level outcomes are reported in Module 3, and then any individual and family level outcomes are reported in Module 4. Questions. For the indicators, can we only report the statistics on our service population, or do we have to report a change in statistics in the wider community? And then you will see the answer on the next slide, that you report the change to the entire community. Because you are, in effect, working community level change. How do I report targets in Module 3 for the life of the initiative or for the year? And the answer, an initiative should have a target that you want to reach by the end of the initiative, and you may outline interim goals and update the targets within your yearly submissions. And I am going to turn the remaining over to Mary Beth.
Thanks. So question, my agency maintains a senior housing complex that we built 15 years ago. Can I report this in Module 3? And the answer here is that OCS does not support retroactively reporting on previous projects that are still being maintained. Essentially, the change that happened in the community has already occurred, so you would report the people that you serve in Module 4. So question, I created a new after-school program that feeds low-income children in my community, and it serves 83 kids each day. Would I report one program created or 83 times the number of meals for the total meals created? And the answer here is that you're really only going to report that one program that you added to the community. The kids that are served, again, get reported in Module 4. So one of my favorite questions is, do I have to fill out Module 3? And the answer here is that you only have to complete Module 3 if you are engaged in community level work. Now, if you're engaged in community level work, you should be reporting in Module 3. With that, I want to run through some tools and resources that we have available on the NASCSP website about community level work and the annual report in general. The first is the lexicon. This will help give you definitions for some of the commonly used terms and might be able to help clarify any questions you have with the wording in the report. We also have this examples, definitions, and notes document to give you some examples by those community national performance indicators to show you some examples of projects that might report in those kinds of CNPIs. And then also just some general notes, tips, and tricks that we have in the bottom of that document. I just wanted to kind of walk you through how you would find this on our website. When you get there, if you go to CSBG, Data Collection and Reporting, it will bring you to this lovely page where you'll select CSBG Annual Report. And then from there, what you'll wind up with is a listing on the right-hand side of your page where you could essentially go to any of the modules and find the resources along with the instruction manuals. So with that, I think that we are open for questions. And Lawrence, did anything come through the chat that we haven't responded to? Pamela, do you want to take that, or you want me to take it? You want to tag team?
Sure. The question, community level change, can be intimidating to agencies as community level issues may appear to be beyond their individual capacity. How can agencies approach community level initiative in a way that is compatible with their capacity? Is it focusing on a specific neighborhood or manageable area? Is it focusing on forming partnerships? Where can agencies begin to consider such an initiative? And I think actually, Chris, the answer to your questions are actually in the questions. Yes, it is focusing on a specific neighborhood, but it also is identifying and focusing and forming partnerships. So you can be able to identify, again, with the community needs assessment, what is the need? What is the specific target service area? And knowing that if you're a small agency, this is not an initiative that you would want to take on or take solo, but being able to strategically identify the partners, that can help in achieving the community level change, specifically identifying what your role is and also identifying what each of the partners' role would be in working on that initiative. And so, Mary Beth, do you want to add anything to that?
No, I think you covered it. It all comes down to ultimately what was the need, what level did the need exist on, and then determining if responding to that need, number one, fits into your agency's theory of change and your strategic plan. But then also, if it's a need you want to take up, you have to decide if it's something you have capacity for or you need to engage those partners. So, it's not a one-size-fits-all answer. It depends on a lot of factors at the local level.
Yeah, and just to add to that, there may be some needs that you can't address. And so like Mary Beth said, you'd want to take the time to build the capacity too before engaging in the work that you want to do.
I think that we wanted this to be the beginning of a conversation. We realized that as folks are actually going in and doing the reporting and thinking about these community level initiatives, that they may have different questions. So for the next session, what we're hoping to do is a little bit of a deeper dive into, based on the specific needs of the region and the questions that the region has. So it can be a little bit more tailored just to fit your all specific needs. Pamela, anything to add there?
No, and I think that's it, as far as the questions ahead of time. And maybe we can conduct coordination with Lawrence at CalCAPA so that as we, after this webinar, and if you think of some questions, because typically, historically, you'll always think of questions once the workshop conference has ended, you can submit those to Lawrence and then he can forward them to Mary Beth and I, and those will be considered as we're formulating the presentation for the session that will occur in October. Great. Thank you, Lawrence. We really appreciate being able to provide this information, knowing that it is an area of priority and interest to the network, and we are available, Mary Beth and I, to provide training and technical assistance. You have our phone numbers, our emails. Give us a call. You can email us, shoot us an email with any questions that you may have, and or if you need us to come out to provide a more personal training and technical assistance. Mary Beth, any closing remarks?
Ditto.
Okay.
Thank you, everyone.
All right, great. Thank you.